On any given day I manage 4 to 7 ventilators in the Rosie the Riveter Respiratory Therapist Woman Nurse Shirt ICU. That means I am actively monitoring the patient, collaborating with other disciplines, and optimizing the therapy. If I have to manage more than that, quality of care declines for sure. But in what could be a we will do the best we can. Yes, an ICU doc can manage the vent. That's one of the most important things they do in the ICU on a daily basis. In our hospital, we would round twice a day and make adjustments each time at a minimum. But the real magic happens in the labyrinth of sub-menus. We make things more comfortable, more effective, and safer in the tiny details. Rosie the Riveter Respiratory Therapist Woman Nurse Shirt, Tank Top, V-neck, Ladies tee for men and women, V-neck, tank top. It varies. Some nurses never bother to Rosie the Riveter Respiratory Therapist Woman Nurse Shirt learn and just call RT every time the machine alarms. Others have picked up a little bit here and there and aren't afraid to play with the numbers a little. But officially, we receive very little formal training in school or on the job. Doctors do the settings based on blood and RT pulse, while the RT usually manages the vent. It's under orders from a physician to do so. I'm a biomed. I fix the medical equipment, and have worked at multiple hospitals. I have met multiple practitioners who work in NICU and ICU who cannot properly operate a ventilator. On multiple occasions, I've had to give in service to entire groups of staff on how to operate them. Official Rosie the Riveter Respiratory Therapist Woman Nurse Sweatshirt, Hoodie, Sweatshirt, Hoodie. I work with neonatologists and pulmonologists every day. Could they manage a Rosie the Riveter Respiratory Therapist Woman Nurse Shirt vent? Sure, just not very well. It's not what they do. They are really talented and most brilliant. It's like asking if a really great guitar player can play drums. Sure, they can play, but you'd rather have the drummer on drums. Your lol is noted. Was that an instruction for me to laugh? Are you let me know you are laughing at me? What do you mean by managing the vent? Do you mean you are clinically assessing the patient and changing their settings? Or are you talking about managing the technical features on the vent?